Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms. You have seen me here every month as we partner alongside UTMB Health, our preferred provider for Southeast Texas, Clear Lake and the Bay areas. And every month we want to bring you topics that we think you should know about or care about, things that you need to know as moms and as parents. And so today we are diving into all things adolescent gynecology. I know many of us have teens and tweens at home, and we have some questions that we would love to have the experts answer. So we were fortunate enough to grab two of those experts who are practicing OB-GYNs with UTMB. I have Dr. Patel with us and Dr. Muruthi, and they are going to help us break down all of this adolescent gynecology, what it means, who needs it, and why we need to know about it. So Dr. Patel, can you give us a quick intro for you?
Hi, yes, thank you for that introduction. I'm Perrin Patel. I am a practicing OBGYN here in Galveston, Texas. I'm actually a transplant to Texas. I'm originally from the Northeast. I was born and raised in New Jersey. I did college and medical school at Drexel University in Philadelphia. And then my husband and I came down here for our residencies, and we've stayed ever since. We really enjoy island life.
I bet. It's hard to leave once you're here, right? So thank you so much for joining us today. And Dr. Muruthi, over to you.
Joyce Muruthi. I am originally from New Orleans. I did my undergrad in New Orleans and my med school in New Orleans at LSU, and then went off to Albuquerque, New Mexico for residency, and then made a little pit stop in Mississippi where I stayed for a couple of years, and then moved here to be closer to my family. So I'm very excited to be here. And I practice in Friendswood.
Wonderful. Well, thank you so much for being here. For those of y'all who don't know, I graduated from LSU. So I have
Go Tigers.
yes. So we always love our Louisiana transplants that make a home here in Houston. So thank you so much for joining us today. We have a lot to get to, so we're just going to dive right in. Dr. Patel, what even is adolescent gynecology? Can you explain kind of what that is?
Absolutely. So gynecology is the care of women kind of throughout their lifespan. And then when you focus in on the adolescent patient population, you're looking at preteens, teenagers, and even women into like their early 20s. And we are looking to help them with the breadth of their women's health concerns. So this can be their menstrual problems, birth control, family planning, anything that might be related to sexually transmitted illnesses, their sexual life. Sometimes it's even their mental health, especially nowadays with COVID impacting kind of everyone's day-to-day experiences. That also takes part of what I do.
Okay. And Dr. Muruthi, what kind of needs and concerns would prompt somebody to go see an adolescent gynecologist?
It's a wide range of things. In our younger teenagers, our 12, 13, 14-year-olds, it's often irregular periods. They get their period, they're not quite sure how to manage it. It's heavy, it's difficult. As they get a little bit older, they start coming in more for birth control concerns, or sexually transmitted infections and sexual health concerns. And as they get, into their early 20s, it's still the same discussions of birth control. Sometimes it's pregnancy, family planning, that kind of thing. So it's a wide, like Dr. Patel said, a wide range of things that we see in our adolescents.
So, I mean, for me growing up, I was a child of the 80s. I don't want to give away my age, but well, I'm 41. So for us growing up, it was like 18 was kind of the transition to go see a gynecologist. But I'm feeling like it's a little earlier now. So what age is recommended? Dr. Patel, I'll let you take that one as to when a child or an adolescent should first see a gynecologist.
I always recommend seeing someone as early as even 12. So I think that's a completely acceptable age. A lot of girls are already having their cycles at that age. So if you've started cycles even sooner than that and maybe experiencing problems with your cycle, it's completely reasonable to see an adolescent gynecologist even prior to that age. Especially when we talk about things like HPV vaccination and the fact that we do want that getting done at an earlier age. Shout out to all the pediatricians that are doing an excellent job getting young children vaccinated. But sometimes they're not comfortable discussing birth control, especially for cycle regulation and management of acne even. So I think that's completely reasonable to send kids as young as 8, 9, even to a gynecologist.
Oh, wow. Okay. So that is a lot earlier than I anticipated. But I do think, as in kind of my breadth of circle of friends, girls are starting younger and younger, their cycles. So I can see how that happens. Do you agree, Muruthi, Dr. Muruthi?
I do. And I think part of what is also really important is that at times going to the gynecologist can be really intimidating. So I think some of our patients and definitely some of our moms kind of feel like, oh, it's too early. But it's important to bring them in so that they get comfortable in the environment and that they feel safe and they have somebody they can talk to. Because most of the time, if you take somebody, an adolescent, like Dr. Patel was mentioning, to the pediatrician or to primary practice type of situation, they may not feel as comfortable talking about menstrual cycles and uteruses and all these words that people get intimidated by. So yeah, I totally agree. As soon as if they start their period early, if they have these concerns, bring them in. We'd love to see them.
Well, and I think that's a really important point, because when we go to the pediatrician, it's typically for our child's well visit. And there's so many things that we have to cover during that, 10 minutes you get with the doctor. And so, to have someone who specializes, and I will say, that's what I always say about UTMB, y'all have such a great primary care network, and then all these fantastic specialties that they can refer out. So from let's say you're taking your 12-year-old to see you. What does a typical visit look like for both the mom and for the child?
Absolutely. So I just had a patient like this a couple weeks ago, and I typically will sit down with both the mom and the patient and have an open discussion about concerns, what brings them here, what they want to discuss, and of that, what they want to discuss together. And so typically at that initial interview, most of the time it's driven by the mom. And the mom has certain things that she wants discussed, and she has like a checklist. And then I'm always looking at the patient, trying to gauge how concerned she is about the things that mom is concerned about, and trying to get them on the same page. And then I always have a portion of the visit that I do with just the patient alone. So I'll always ask the mom if she's okay stepping out and just waiting in the waiting room while I have an open discussion with the patient. And I explain to moms that I explain to the patient, there is doctor-patient confidentiality. I will not tell the mom anything the patient reveals to me. And I tell the mom that I want her to be comfortable with that. I have a daughter. And so I want my daughter to have a place to go to that's safe, and to a person that she feels comfortable with telling potentially very vulnerable information to, and not be afraid. Right. And I want to be that person for a lot of young girls, and I want their moms to be comfortable with that too. And I would hope that they both trust us the same.
Right. And I think that's such an important point. We've chosen you as a provider. And so, hopefully we are okay with our child being able to share and express their concerns, because as much as I want to be an open door for my daughter to come and tell me everything, I just know she's not. And I need the expert on her side. So kind of switching over. So So Dr. Muruthi, after you've kind of had that chat and what have you, I mean, what does a typical first visit like? Are we doing exams, or are we just chat? Like, what's happening?
Usually the first visit is just a chat. There's really very few reasons that I would do a pelvic exam on an adolescent at the first visit. And a lot of that is because there is such a huge kind of fear factor that comes into going into the gynecologist for the first time. So that first visit is really just a let's get to know each other, let's, be comfortable in this environment. And if down the road we need to examine things and look at things, that's totally fine. But that first visit is really just a chat.
Okay. See, and that already makes me feel better about the process, just knowing that. I mean, we know when we go for our annuals, like what's expected of us, right?
Right.
Um, but to know that it's different for adolescents, because obviously they're, that's a different age group, a different maturity, and all of that. So, I would say we've kind of touched on how you keep it a safe space. What would be the concerning things that you would need to escalate, or like what are you typically seeing? Are we doing birth control for cycles? Are we doing birth control for sexual activity, or what is the typical patient that's coming in?
Oh, I feel like there is no typical patient. It can be it's something different. And it oftentimes is not what you expected, because like I said, a lot of times mom makes the appointment. Mom has an issue she wants to discuss. And then when you get alone with the patient, if you've built that trust, and sometimes it's immediate, sometimes it takes a couple of visits, it can be something completely unexpected. So I think the best part, especially when you're dealing with adolescents and teenagers, is to not look surprised.
Right.
Absolutely. Absolutely.
The poker face.
Yes. And I think too,
or if anything interesting.
Oh, go ahead.
Go ahead, Dr.
I was just said, yeah, Dr. Muruthi, take it away.
Oh, I think, what you mentioned about the mom has one thing to say and the patient has another thing, especially in the field of gynecology. It's, women want to share their stories of when I got my period, this happened, and when I went through this. And so sometimes you kind of have to take your time, earn the trust of the patient, and really work hard to separate what is coming from mom and what the patient is really looking for. And that's where that earned trust comes in, because family history is very, very important. And we ask those questions for a reason. But sometimes, you can look at the patient and be like, my mom's talking about my period, but I'm really here because I want to talk about birth control.
Yeah. And I think that's such a skill that y'all must possess, to be able to get to earn that trust where they want to share those things with you. Because, as we've learned, there's nothing more important for the past year and a half than our physical health and taking care of ourselves. And so kind of going off that, how often do y'all recommend, like, for a person to have, like, let's say we've talked about when you kind of get the baseline, but then are we going back yearly, or is it dependent upon the circumstances?
I usually say yearly if there are no concerns. If we're working on cycle regulation, and they're going to choose the route of doing a birth control pill, we can have them come back at 3 months. And if it's something that works for them, they like it, they don't have significant side effects, or they're tolerable and it is regulating their cycles, at that point we can extend it to a year. Just depends on what we're doing and what type of progress we've made. Okay.
Yeah. Perfect. So as we kind of touched on, building that relationship and physical health, and but we mentioned at the beginning, mental health has taken a toll on our adolescents, especially, and there's been so much that has been rocked in their world during these crazy COVID times. So, Dr. Muruthi, can you kind of explain how you all help guide also the mental health aspect of adolescent gynecology?
So in our clinic specifically, we have an intake form that kind of asks some of those questions. You know, we do recognize that there are some things our adolescents may not want to disclose in front of their parents. So we ask those questions in our intake form, and then we usually follow up with them at their next visit or in that time when we're alone with the patient, kind of talk to them about what it is they're looking for. I had a patient recently who came in and she was really concerned that for her, she was fixated on this idea that she would never have children. I'm not sure what TikTok she watched, but she was pretty convinced that that was going to be the case. So working with her through that in the visit, but also having accessible resources where, you know, our adolescents can reach out and talk, whether it's finding a mental health counselor or a psychiatrist, helping them navigate that process.
And Dr. Patel, thank you so much for that answer. And can you explain a little bit how UTMB works? So if you have a patient who might be exhibiting signs of mental distress or that there are concerns, what's the process in helping them get resources and assistance?
Right. So we have an excellent psychiatry and psychology department. And so we kind of target it from two different angles. We want the patient hooked up with a therapist, somebody that they can talk to, and then also potentially a psychiatrist, somebody that may be available to prescribe medication should the patient need it. So I try to plug them into both of those systems.
And I think that's really important that you all kind of stay in touch too. So that way, you know, your patient might be seeing this person, but also on this medication, not, you know, just making sure that everything y'all are doing is working as one. So I think that's just such an important aspect. And we got to take care of our kids, man. TikTok it's a whole, that's a whole other ballpark. So I know we've kind of covered a lot in a short amount of time. Dr. Patel, is there anything additional you would like to add as it relates?
I think that there is sometimes a fear and a stigma of seeing a gynecologist. And I really want moms and young women out there to realize that we're here to help them. Back in the day, there was this fear of, I know I've had moms that will scare their teenage daughters about painful pap smears and speculum exams. And as Dr. Muruthi mentioned earlier, we're not doing these exams on young adolescents, especially if they're not indicated. It's one thing if maybe there is a concern and we need to do it, but there's always a dialogue. Decisions are made together. And ultimately, it's all about patient care.
Perfect. Dr. Muruthi, anything you'd like to add?
I think, you know, to kind of add to that, I would like to see women's healthcare, GYN care become part of healthcare in the sense that, you know, if you have a problem with your heart, you go to the cardiologist and you don't feel any shame or embarrassment about it. So it's the same with reproductive care. And one of the things I know we're both very focused on is education. We want to teach our adolescents and our patients about, you know, how their body works, because the TikToks of the world, there's a lot of misinformation and disinformation and all kinds of weird, wacky things out there. So we want to be that place where our adolescents can come and not just get taken care of, but also learn correct and accurate information about what's going on in their bodies.
That sums it up for me as a parent. I want them to have the accurate education because there is so much misinformation out there. And it wasn't the way we were brought up, at least I was, it was a very quiet thing. We didn't discuss, you know, sex and birth control and all of those things. And I actually made my own first gynecologist appointment because my mom it was just very old school. And I think now is kind of our opportunity to sort of pivot the conversation. And I love making it that if you know, I mean, we're all women, we have uteruses and things that we need to take care of. And now's the time to start taking care of it. So I think that sums it up perfectly. So we will drop below in the comments how you can get in touch with the adolescent gynecology department at UTMB Health, or if you even need your own gynecologist. I'm going to drop that link below. And then if you haven't had a moment to watch this video, we are emailing these out in our monthly newsletters. So we will also drop a link for that so you can sign up, so you can get the newsletter, because we have about, I think, 9 videos now of experts from UTMB, whether it be cardiology, all the way to now adolescent gynecology. So we hope you'll check those out as your needs arise. Doctors, thank you so much for joining us today.
Thank you for having us.
Thank you.
Absolutely. It is our pleasure each month to bring you these monthly health videos from UTMB, our preferred provider for Southeast Texas, Galveston, since we have a rep from Galveston here, and the Bay Area. So we are happy you joined us. If you have any questions, pop them below too. We'll make sure somebody comes back and we answer those for you, or we'll point you in the direction for your resources. So until next time, we'll talk to you soon. Bye-bye.